Hello, my name is Doug Drabina. I am the Chief Development Officer and founder of Family First Home Care. Here at Family First Home Care, we are dedicated to making sure that we stand out from our competitors. How is it that we stand out from our competitors? We have the best training programs that we have in home health care services. So when you come to Family First Home Care, know this: you'll be well educated, you're gonna get some of the best pay rates, you're gonna work with some of the best people, you're gonna have some of the best patients that you can possibly be with. Here at Family First Home Care, we are 100% dedicated to you, our nurses. So thank you for what you do. And without further ado, here's Dan Netto, our Director of Respiratory Services.
Hi, my name is Dan Netto. I'm the Respiratory Care Director here at Family First. And today we're going to look at the Trilogy 100 ventilator and give you a better understanding of it. What I first want to do is I want to make sure that you know that the ventilator always sits on top of the humidifier. The humidifier actually is in position underneath the ventilator. Okay, so the Trilogy has a handle, so you can carry it on top. Usually it stays down in position on your stand, but when you're traveling, there's even bags and whatnot that you can get from your DME if it is available. Notice again the most important thing here is that we have a bacteria filter. A bacteria filter is very, very important as it protects the machine from the patient, from the machine. In other words, basically, if the patient gets Pseudomonas or pneumonia or whatever disease, and they don't have a bacteria filter in place, it will actually go inside and contaminate the machine. And then when the patient goes to the hospital, gets better, they come back home, there they go, put them back on the same old vent, and that disease is, or what a bacteria is sitting right inside. So we always want to make sure, even on our backup ventilators, that we have a bacteria filter in place, as that will protect the machine. Okay, so we have a bacteria filter. This is where the outflow comes. You can see going to the back of the ventilator. The very first thing I want to show you is this is a sprint pack. This is a battery. That's an external battery. The battery life inside of this machine without being plugged in is about 4 hours. So there's an internal battery inside for 4 hours. And then you have a sprint pack, or actually the detachable. It's kind of like a sprint pack, detachable battery. You could tell by how many bars are lit up that it's fully active. You can get spare batteries from the DME if they give them to you, so you can have extra ones if you're traveling. They're very easy to put in. You basically put it in and snap, and there it is inside. So if you have two of these, make sure they're both charged. Very important that we keep them charged. You'll see over here, right over here is where the plug would plug into to the external power. I'll show you that in a second. Going back to the side over here, we have an information port. This is where the DME company can actually go in and do a forensic audit of everything that's happened on this machine since it's been made. They can go in and update the software. Anything they need to be done will be done through that port. Right here is where the siren is located. The siren is what will go off where the alarm actually comes out of. You'll see over here that there is a patient assist, which can be plugged into an external siren that could be in the parent's room, so they can hear if the alarm goes off. And most of the time, they don't use that. That's why we have nursing. And when the nurse isn't there, the patient usually sleeping with mom. So, and the DME does not provide that. The difference with this machine here is that all of the supplemental power is actually done right through this portal right here. You'll see that there is a multi-port or an accessory port from the car, and this is that you can use that when your car you want to save the battery. You'll also see right here, this is important. This is where the oxygen goes in. Notice that I clicked it in, snapped in place. This is very important. These break off. Oxygen must run through the machine again so it mixes with the flow to make sure it gets a nice even flow and doesn't distort any of the settings that are in the machine. Very important. They come in a package of 2. I would even take one and tape it right on the top of the machine, so if this should break, you got to have it. So make sure that you have these extra ones from the DME because the oxygen must run through the port. Okay, so besides the detachable battery, you have an internal battery inside as well. The internal battery will last, if this is not charged, it will last about 4 hours by itself without being plugged in. You can actually see that the battery lights up full, and it will clip right in the back. You'll see over here all the other alternate sources of power. There's a marine battery will attach right in over here. That will give you about 12 hours, so total about 24 hours of notice between all the batteries. Also, your car adapter will also plug in over here. It's very important that you save the integrity of the machine by protecting the battery. Now, going to this side of the machine, you'll see that this is the basic Trilogy. There's different ones, different styles, different evolutions. This one here has the SD card, which actually would plug right inside of here. So technically, you can bring that card to the pulmonologist, and they can see the readings or the performance that has been happening since their last visit. Really, today we don't use that because we take the machine with us. Because if the doctor is going to make the changes, we want to have the machine with us when they're making the changes, and make sure you're going to take your backup ventilator as well. This ventilator also has Bluetooth capability. This particular one does not, but it has the ability to actually transmit to the pulmonologist what is going on with the patient in live time, so they can actually make adjustments and they can see what is happening through the radio waves, and that's one of the newer ones. Some of our patients have them, some don't. It's just an added feature. You can see I'm going to turn the power on, and I'll be able to light up the screen for you and actually be able to show you the controls. You'll notice this time now I have it plugged into the wall. This is the only time you would use this portal right here that's on the side, is when you're plugging into the wall. The rest of it, there goes an alarm. We'll go ahead and shut that off. That was a low circuit leak. That's probably because I'm in mode here of trying to show you the ventilator. So we'll be quick to do that. What you're going to see is you want to be able to get to the doctor's orders. Okay, you want to know what the settings are. So what you would do is on the top button, just flip up and go down all the way to information. You would click on information, and you will see right in line as you go down all of your settings. So you'll see that it is an SIMV, circuit type passive, tidal volume 500, breath rate 10, inspiratory time 1, flow pattern ramp, PEEP 4, pressure support is off, trigger type auto track, rise time 3. Now, those are your settings. You can verify it simply by going to information. Have no fear that you're not going to be able to change anything. Continue going down, and you'll be able to see which alarms are on. You'll see that I have 2 alarms set. One is low inspiratory pressure alarm of 6 and a high inspiratory pressure alarm of 80. But there's many different alarms that actually can be used. So depending on what your doctor orders, that's where you'll find where the alarms are. So we'll just quiet that down again, and we'll finish that. And what we're going to do now is take a look at the actual, let's get here, the readings, okay? The readings is how is your patient performing. What you see on the front here, on the front screen, are your actual readings. This is how the patient is performing on the ventilator, okay? You'll notice that a machine breath will have, it will actually, it will have a gray, the little gray dot on it. If it doesn't have it, then that would be the patient breath. You'll see the first thing that you're looking for is the pressure, that you would record that. You see how it's moving all over the place? There is a place to record it. What you would do is, since it's moving all over, is just simply put V, variable, because it's moving all over the place. The respiratory rate, you'll notice it was set at 20, so it's giving 20. If it's ranging between 34 and 37, and it's going, up and down a little bit in that area, what you want to do is look at it for 5 seconds and get the average, because that's actually will be fine for the respiratory rate. And I'll explain to you why, because that will that will be actually reflected down here in a minute ventilation. Right here is the VTE, that's the tidal volume. You'll notice a new different reading, it's called leak. The reason for that is that you'll see in a little bit with the circuit, this is a passive circuit with a passive exhalation valve, which means there needs to be a leak, so that's quite normal. It can range anywhere from the upper teens all the way up to 50. So it really depends on how your patient is performing. Just record the number. Again, if it's all over the place, put a V simply there. In the center right here are your most important information right here. This is the more stable numbers. Peak inspiratory pressure, we need to record that. Mean airway pressure, we need to record that. Peak flow, we record that. And minute ventilation, we record that. Reasons for these being so important is the peak inspiratory pressure indicates how much pressure is actually going into the lungs, and is it going up? That means there might be something going on with the lungs. So we want to make sure that we're seeing the trends. The mean airway pressure, if that starts to go up, it might also indicate that there's more compression on the heart and cardiac output could be affected. Minute ventilation, this is why I said that tidal volume is not important. Minute ventilation tells me over a period of a minute how much they're ventilating, and that's the one that's the stable number that we look at. So this is the part what makes the Trilogy unique from the LTV or the dual limb type ventilators. You'll notice there's just one limb. So basically the air is flowing in, and what we need to know is how does the patient exhale? Well, they have a passive exhalation valve, and it can be, they basically, what it does is it goes right after the circuit, and it can look like any of these, right? And I'll show you them individually. It would be appropriate, the size that you would get would be appropriate for your patient. This is how they exhale, so when they're breathing, they would breathe in, and then they're exhaling out through the side port. So it is dependent upon the size, depends on the size of your patient. There is one, however, which is the whisper swivel. This is one that the manufacturer recommends. Sometimes you see them, sometimes not. These work just as well. You'll see that it snaps on and off, kind of like a little rocket ship. The difference is that when you're putting pressure on this, or as you're rolling around, there's no pressure on it, so the ability to have a blockage or be able to interfere with their breathing is non-existent. Whereas you can see with this type, you got to be real careful that this is not actually covered by a blanket. It's also not pointed in the baby's face because you have the air blowing in their face. You want to keep it away from them. It's very, very important, and make sure that it's not covered. Again, knowledge of where this is is very, very important, and being conscious of that. So again, we want to keep this going towards the patient's trach, and we want to keep it in a downward position so we prevent any of the water or condensate from going back into the patient. Okay, so now we're going to actually connect to the patient utilizing the ventilator with a heated humidification system. Remember, again, as we talked about before, the humidifier always goes below the ventilator. Okay, so it's pretty simple. We have our bacteria filter. We're going to take our short end, put it right into one side, and then we're going to take the side that goes to the patient. We'll talk about that in a second, but we'll do this part first. And what we're going to do is we're going to actually simply put that on this side. Now, the same thing, we have to power it. There's two sets of cords. Okay, one is the power cord. You'll notice I have one side tied off because the manufacturer actually uses this same piece for many different ventilators and different humidifying systems. So we make it simple. The Trilogy and the 1150 utilize what I call the Mickey Mouse ears because it basically is 3 little ears there. And so the way it would go is you plug the yellow right into the yellow. Now remember, this is for your heat. This is how you're going to heat it. And you're going to put your Mickey Mouse ears, let's call them right here. So now you have a heated humidifier. Now, since you have heat, you need to be able to monitor the temperature. So what we have is the temperature probe. We have the machine temperature or the distal temperature. I'm going to again put the blue one in here. It slides right in. Now you can see that I actually unplugged this part, and again it will simply go right into where the little notch is, You can see it right there. There's where the notch is on that one. This, again, is a lot easier to use. You can actually take these all the way down and attach them so that they stay nice and clear and away from your patient. And you would take this one, and this reads the temperature near the patient. Okay? And there we go. A lot easier to use. Now, what I want to talk about for a second here is, I'm going to remove this off, as basically, let's get that out of the way for a second, is the assembly. Notice that you have, this is again where you can use your OmniFlex. Again, there's many little pieces that you can use here. What we're going to do is, if we needed to do an inline nebulizer, again, what we can do is simply put this on the top, okay, and there you go. Pretty simple, because I already had these attached. So you can see I had to make that, and that's what the DME would do. So make sure when you're ordering parts that you have these on hand, and you get a good picture idea of how they're going in place. So again, the same way, your nebulizer would actually, you would open this up, and your nebulizer would attach to it, and simply, it's spring-loaded again to keep it protected. You would give your nebulizer treatment, and you then, when you're done, you can simply alcohol wipe and cap off and keep it in place. If you're getting them, regularly, you keep it in place. If it's PRN, you could take it off if you want to, really no issue. If you were using an MDI, okay, and a meter dose inhaler, what you'd have to do is, again, we're gonna be MacGyvering things. That's what we do here. And so we put that one in place. We got that one in place. I'm going to, this should actually go right inside of here. So, and there. So this would be for a meter dose inhaler, okay? So again, very important. You have this in place. You have it covered. You're about to give the treatment. You attach it and make sure on inspiration, so as the patient breathes out, you'll hear it go, and then you're gonna squirt as they breathe in. So make sure they get all of that medication inside. Let them take another breath to recover, and then if it's required to do another one, you would then do it. Of course, you would follow the instructions that are on your 485 for that. So that's pretty much how you would handle giving a treatment with these. Again, be aware that it's very important that you know how these are set up in advance, so when the DME comes, make sure you take pictures of it, or make sure that you have the spare parts of everything that's needed to complete a circuit, and you have plenty of them. So now you have your patient is on the machine, everything's fine, and all of a sudden it starts to alarm. We're not going to simply just shut the alarm off. We know that there's a problem. We know that it's going to be in one of three places. It's either going to be in the patient, in the circuit, which is everything from the bacteria filter all the way to where it connects to the trach, or in the machine itself. So our priority always is the patient. What we need to do first is we need to look at the patient. Obviously, that's what we're going to do. If the patient looks like they're fine, we can shut the alarm off if we want. We're going to look at the pulse oximeter, look at the heart rate. That looks fine. Their demeanor, it looks fine. We're going to take our stethoscope out, and we're going to listen to lung sounds. They may be fine, everything's fine. Then we're going to we will put our hand on their chest, and we'll feel if there's any kind of tactile phragmitis or any kind of bubbles that are inside. That could mean that the trach dislodged. What we do is, if the patient is fine completely, the chances are the issue is going to be in the circuit. So what we have prepared is this is an emergency, basically an emergency circuit. This will be hanging by the side of your bed, and what we would do is, since we know the problem might be in here, we're going to try to eliminate that problem pretty quickly, because we have one that is ready to roll. We can simply disconnect that from here, go right over here with a whole fresh new system, and we're ready to go. We can now eliminate any of the problems that might have occurred inside of here. And now if it's still alarming, it's the machine. At that point, we would bring out the backup ventilator if we have one, and we would use the backup ventilator. Don't be afraid to bag. Your bag, ambu bag, is a ventilator, and we want to make sure that you do, that you do ventilate your patient. So while you're bringing out the backup one, it should be set already up. You turn it on, and you can take this right from it and plug it into the backup one. If you don't have a backup ventilator, that's when it gets a little bit more tricky. What you're going to have to do is, if the problem is in the ventilator, first thing you're going to do is call 911, and you're going to ask for an advanced airway team because you have a trach vented patient that the ventilator is malfunctioned. And so they can come on their way to pick the patient up. You're going to then call the DME, and the DME is going to have to replace the ventilator and give you further instruction. They'll end up going to the hospital, bring the new ventilator there, and then the patient can come home. Again, it's very, very important that we don't wait for the DME to come out with the ventilator, because it could take hours. And we don't want to do that, be bagging all that time. We want to protect our patient. So that's pretty much what you're going to do in an emergency situation. So this concludes the segment on the Trilogy 100. I hope you've enjoyed it. And remember, at Family First, if you don't know what you don't know, you won't grow. Thanks, and have a great day.